Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Matt Deibel. We enjoy having you. Thank you so much for being here again, Dr. Deibel.
Thanks for having me again.
Of course. Okay, so today, Dr. Deibel, we are talking about safe emergency care. So can you tell us about some of the trends that you've been seeing as an emergency care provider?
Absolutely. So in the spring, we saw COVID patients coming in and getting hospitalized. And fortunately, through the summertime and a lot of different efforts from individuals and as a community as a whole, we saw that number decrease, which was wonderful. Unfortunately, towards the end of October and all through November and starting into December, we've seen a significant increase in the number of sick patients who are being hospitalized for COVID, to the point where it's a lot more than we saw in that first wave. It's true here the same as it is throughout the nation right now.
Right, and we are right in the middle of this pandemic. You know, there's a surge happening right now. So what do you want people to know about seeking emergency care?
I think the bottom line is please don't stop seeking care. We saw this in the springtime when people heard about the virus. It was pretty new. People were nervous about coming into the hospital and getting care. And so because of that, they might have some chest pain at home and normally come into the hospital, and they chose not to. Of those people, some of them had bad things happen. We saw the EMS people reported that there was an increase in people having heart attacks at home. And we don't want to see that again. We've seen for the last couple of weeks definitely a decrease in people who are seeking care, who are coming in like they normally would for chest pain or abdominal pain or other serious things that need to be evaluated right away. So I think the bottom line is please don't stop seeking care. We want you to be in there. We want to make sure you encourage your loved ones to come in and get care.
That's so important. And you know, people are so fearful and they have anxiety during this time about going in to get care. So what would you say, what would you tell them about what Covenant's doing to make sure and ensure that they are safe when they seek emergency care?
So I start with highlighting an independent group called Leapfrog has repeatedly given us an A grade in safety. And so our baseline, and I will say this comes because of a lot of efforts from a lot of people. And so at baseline, we already do a good job with safety and keeping you safe. On top of that, right now we have, like other places, we have masks. We are doing even more cleaning than we normally do. We have temporary visitor restrictions right now. In the emergency care center, we have 65 private rooms to take care of people. So we do have a safe private space for you or your loved one when you need care.
Now, Dr. Deibel, if people think that they are having an urgent medical need, what's the first step? What should they do?
So it depends how bad it is. If you're like, wow, I'm having a really hard time breathing or some bad chest pain, call 911 and come on into the emergency department. If you're not sure how serious it is, I always say, please give your doctor a call. Your doctor will advise you. That's what they're there for. They will walk you through and say, you know, this is something that you do need to go in right away, or this is something I can see you in the office for later today or tomorrow or next week or whatever makes sense. So again, if it's really bad, call 911, come on into the emergency department. If you're not sure, just give your doctor a call.
Dr. Deibel, as we head into the holiday season, what are some things that we need to know and tell our loved ones about preventing the spread of COVID-19?
So this pandemic is like a race. Unfortunately, it's a long race.
Yes.
Or at least it's felt like a long race. And with all the good news of the vaccine, and I tell you, I am very excited to take the vaccine myself. With all the news of the vaccine coming up, it's almost like we're starting to see the finish line. And in some ways, when we hear good news, we think, hey, we can kind of relax a little bit.
Right.
Where in a race, it's the exact opposite. When you see you're close to the end, you try harder because you know it's almost there. And that's what our ask is throughout this Christmas season. Is we need to double down on our personal efforts. The biggest thing that spreads this, we know, is gatherings where people are not wearing masks. And so if you are around others outside your household, please wear a mask. Make sure you're washing your hands. make sure you're social distancing. All those things make a real difference. The activities that you may normally plan for Christmas time, I know we have lots of traditions. We gather with my parents for a giant caroling party. We all sing together inside the house.
Nice.
That's a really bad idea right now. So we canceled that this year. And that's kind of tough. But you know what? Next year is going to be all the sweeter when we're able to gather again.
That's right. You can go all out next year, have a big shindig.
Yes, that's exactly.
Dr. Deibel, tell us, is there anything else that we haven't covered that you think is very important right now during this COVID-19 pandemic?
I would say just at this Christmas time, our healthcare workers, anybody who works in healthcare, no matter what role you have working inside a hospital or inside healthcare in general, this has been a very physically and emotionally draining year.
Yes.
If you could go out of your way and thank them, that would go so far. Ask them how they're doing. Thank them for their efforts, and it really does make a difference.
I think that's so important. And we thank you for all that you do, because you're working there in emergency care, and all of the healthcare workers out there on the front lines helping to keep us safe. Thank you, Dr. Deibel, for joining us, and thank you for all that you do. We appreciate it.
Thank you much.
You're welcome. And if you'd like any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.